after doctors told a Northern California family that their unborn baby had one of the most severe forms of spina bifida. What followed was a groundbreaking procedure before birth, and now it's inspiring families and researchers. And our champions of hope, we introduce you to baby Nixon.
Want to show them how fast you can go?
Sometimes miracles are the simple things.
You want to keep going?
Like riding a bike.
That's awesome.
Or taking little steps up.
Hold on to the side.
To go down a big slide.
Nice.
For Lindsay Metcalf, hope and science turned walking into a reality. Something Nixon's mom, Lindsay, calls a miracle.
So we got a phone call that my blood work had come back elevated. So we scheduled an ultrasound, and that's where we found out that Nixon had spina bifida. Is at the ultrasound.
See, Nixon was diagnosed with one of the most severe types of spina bifida, a condition that happens early in pregnancy when the spine doesn't close the way it should, leaving part of the spinal cord exposed. Lindsay remembers the fear and the shock.
And had a doctor come in and list all the worst things that you can imagine. So paralysis, brain abnormalities. It was definitely the hardest day in the whole journey was diagnosis day.
Spina bifida can affect brain development, bladder and bowel control, and make walking impossible without support.
They tell you all of these things, and in the same breath, they ask you if you want to continue your pregnancy. And you're in a very vulnerable state, and your mind goes all places, right? Like, how is this going to affect me? How is this going to affect my other kids? Can I do this?
Lindsay and her husband didn't stop searching for hope. They discovered a landmark trial in Northern California, the CURE trial, the world's first spina bifida treatment combining fetal surgery with stem cells. The groundbreaking trial at UC Davis Medical Center is the culmination of decades of research into healing spina bifida before a child is born to prevent damage rather than manage it after birth. Doctors like Diana Farmer, a pioneer in fetal surgery, use stem cells to essentially give the developing spinal cord a chance to heal while it's still growing.
So the living stem cells that we give to these patients, put right on top of the spinal cord, that developing spinal cord, secretes nerve growth factors and other things that help repair the nerve, prevent further inflammation, so help prevent further damage, repair some of that, and help with blood growth in that area.
It was a big surgery for Lindsay and Nixon, but weeks later, when Nixon was born,
it was like I was watching a real life miracle. He came out wiggling his toes.
Hello. Hello, my boy.
Then came the milestones that felt like miracles.
When he walked, it was one of the happiest days ever.
Lindsay and her family say they are deeply grateful to Dr. Farmer.
I would tell her thank you for caring. Spina bifida wasn't ever on my radar, and I'm just so thankful that 20 years ago it was on hers, and that she was doing all that work to make a difference in my child's life. Nixon's actually named after her. His middle name, Lee, is named after Dr. Farmer. So she has a special place in our hearts and in our family.
Mommy.
What?
Mom.
What? What's he? Oh, he's going to take a picture. Can you say cheese?
Dr. Farmer says the work doesn't stop with Nixon. It's about advancing care for all children with spina bifida.
Well, that's certainly our hope. But to be honest, I think even if this becomes the new standard of care, hopefully there will be someone who then comes up with an even better standard of care. And that's how science works.
Nixon's journey reminding us miracles can be the simple things, like riding a bike or taking small steps. Because sometimes a little hope and science becomes a force. It can drive families forward and inspire science to keep pushing boundaries.
For Nixon, I know that his future is bright. I have no doubt that he will accomplish anything that he sets his mind to.
Lindsay, thank you so much for sharing your story. Dr. Farmer, thank you so much for your work.